What's the name of your company?
Family First Senior Care.
Family First Senior Care. And here you go. Take it away.
Okay, thank you. All right, well, first I want to thank Ed and the Parkinsons Resource Center for inviting me here to speak with you today. And I thought I would start out by asking all of you a question. How many of you would like to know, by a show of hands, if you need help in your home? Good, probably why you're here today. How many of those of you here would like to have known that you needed help a month ago, 6 months ago, or maybe a few years ago? All right. Well, that's what I hope we're going to accomplish today. We're going to help you understand when you need help in your home. And you may wonder why I'm qualified to speak with you here today. So I wanted to start by just giving you a little bit about my background. I've been in healthcare for over 15 years now and worked in a variety of settings. Many of my years spent working as a registered nurse. I worked in the acute care setting, Holy Family Hospital most recently, and intensive care was my specialty. But I've also worked in skilled nursing facilities, retirement communities, and home health care. And as Ed mentioned, in the year 2005, I opened an in-home care company called Family First Senior Care. And over the last 5 years, we've been able to help seniors remain independent in their own homes. And we've been able to help hundreds of families. And we do that by providing assistance with activities of daily life. These are things like companionship, light housekeeping, meal planning and preparation, personal care tasks like bathing, dressing, grooming assistance, medication reminders, and transportation services, as well as other things. Oops, my notes are covered up here. All right, so based on our experience, we found that many people often wait to get the help that's needed until it's simply too late. So the big question today is how to know when you need help in your home. All right, so our goal today is to address your needs prior to the need for help. We're going to talk about 4 different areas. We're going to look at assessing your need for care, identifying factors that would cause you to need help, create a plan of action, and give you tips on how to choose a provider. Now hopefully you've got noticed that you have a few handouts in front of you. And the first one we're going to look at, I just did a screenshot here. It says up at the top, Needs Assessment Worksheet. And I want to draw your attention to the top here where it says Activities of Daily Living, or ADLs. And you'll see those in the left column, and we're going to be walking through these. You're going to also notice 3 columns that says Accomplishes Alone, Needs Some Help, and Needs Much Help. So, you're welcome to fill this out if you have a pen or pencil handy. You can fill it out as we go, or if not, take it home with you. Fill it out for yourselves or a loved one at another time. Okay. Now, it's really important that you begin looking at your need for help prior to the need being significant. Think of it this way. How many here have owned your own home? Okay, most everybody. Now, of those who have owned their own home, how many of you waited a couple years to, manage the needs of the home, like maintenance and home insurance? Not many, hopefully not. It's the same principle applies to your personal health care needs. And it's really important you begin to look at that the exact same way and start planning ahead. Now today when you're filling out or looking at the needs assessment worksheet, I want you to keep in mind a couple things. Number 1, you need to be honest and accurate, because it doesn't really do anybody good to kind of ignore the truth. And secondly, keep safety in mind when you're filling this out. When I go into individuals' homes and do needs assessments, I find that oftentimes, the person that we're going to be providing care for says they're managing most of these things on their own. Sometimes I'll have a family member in the background who will be nodding their or shaking their head like, that's not quite accurate. The other thing is, maybe they are performing those things, but there's safety concerns with them doing so. So those are things to keep in mind. Okay, so the first ones we're going to walk through are the activities of daily living. The first one is bathing. Now, how are you managing bathing? Completely independent, or perhaps needing a little help, like getting in and out of the shower or bathtub safely? Or perhaps needing a lot of help, which may be, needing help meeting your hygiene needs once you're in the shower or bath, shampooing your hair, that type of thing. The next one is dressing. Are you getting dressed on your own? Or are you perhaps needing just a little bit of help with getting socks and shoes on, getting buttons done and things fastened? Or complete dependence, unable to get dressed at all on your own. Next one is grooming. This is going to include things like oral care, getting your teeth brushed, getting your dentures brushed if you have them. Men, shaving, getting your hair styled and combed. So all those type of grooming needs. Next one is toileting and incontinence issues. Are you able to get to the restroom to and from on your own? Or are you needing help getting there safely? Or perhaps, there's some incontinence issues and you need to use an incontinence product like a brief or a Depend, that type of thing, and may need some hygiene assistance once in the restroom. So those are all considerations for toileting. Okay, the next one is eating a nutritious diet. Now in this section, I'm not talking about the ability to prepare a meal for yourself, but rather the ability to feed yourself. So are you independent there, or perhaps needing someone to hands-on provide some feeding assistance? The next two are getting out of bed and getting out of the chair. Are you able, another word for this is transferring. Are you able to make position changes on your own? Move from sitting to standing position, or getting in and out of bed on your own. Do you perhaps need someone to be there as what we call as standby assistance? You're a little wobbly, a little unsteady, and you need someone to kind of guide you. Or do you need someone to actually transfer you and do hands-on assistance to get you into those position changes? The next one is walking, and this is the last of the ADLs. Walking, are you doing that on your own? Are you using an assistive device like a cane or a walker or a wheelchair? Or complete dependence would be, immobile, unable to move or change positions on your own, using a wheelchair all the time or perhaps bedridden. Now the next group you're going to see here are considered IADLs. That stands for Instrumental Activities of Daily Living. And these are usually the more complex social activities. Okay, once again, if you see that you have a need in a couple different areas, it's likely to signal the need for some additional help. Okay, so the first one is using the telephone. So that would refer to, being able to look up numbers, schedule appointments for yourself, and call for emergency help if needed. Next one is shopping for personal items. This would be grocery shopping, getting your clothes you need and your household needs. Next one is transportation. This is the ability to get to and from appointments and other activities you enjoy. And then we've got managing money. This is managing finances, bill paying, writing checks, the ability to budget. Are you able to do these things on your own, or perhaps needing some assistance? Okay, the next couple refer to housework, doing laundry, and doing light housework. Are you able to maintain a clean living space on your own? And the last one is preparing of meals. So in this section, this is referring to the ability to prepare a nutritious meal for yourself. Ditto. So this would be like, using a can opener, using kitchen equipment like, the microwave oven or the stovetopper oven. And this is an area I want to remind you when you're filling that out to really keep safety in mind. Because a lot of times, as there are memory changes that occur, perhaps a little confusion or forgetfulness, operating an oven or a stovetop can be very hazardous. And so if burners are getting left on or the oven's getting left on, potentially that could have very, serious safety issues. So all right, those were all of the ADLs, activities of daily living, and instrumental activities of daily living. And, I can tell you one thing's for sure. If you simply ask someone how they're managing most of those tasks, they're probably going to say they're doing pretty well on most of them. And I think oftentimes that's out of fear, perhaps denial and pride, and other factors that probably cause them to cover in those areas. So if this care is for someone else, there's some other things you can actually look at that might signal the need for some additional support in the home. And I just listed a couple here for you. Are there spoiled foods in the refrigerator? These could all be signs of inadequate nutritional intake. Are you seeing multiple packages of food, the same types of food or staple? Is there a loss of desire in eating? Oftentimes you'll see some weight loss as well. The next one is there mail piled up or unopened? Are common chores around the house no longer being done? Are there behavioral changes like someone becoming more moody, teary, sad? And the next one is memory issues. This may be signaled a lot. One of the things we see a lot of times is initially with memory issues, there's some medication problems. So we start noticing that medications are either not taken enough, they're being forgotten, or they're being taken too often. Our personal care needs just being neglected. Our doctor's appointments being forgotten or perhaps just missed altogether, the appointments never made. And are the same issues repeatedly being discussed? The same conversations keep coming up. This is a big one. Ask, do I need help from my loved ones? Are loved ones spending more time providing care instead of, just getting to enjoy me, enjoy visiting and sharing in companionship? And is this individual still able to do the things they enjoy, the activities they love, and socialize? And then, of course, you want to look at safety issues. Is someone just simply forgetting or refusing to use their walker or cane? Has there been any falls, at least, one fall in the past 3 months? And are there any noticeable dents or other damage to their vehicle? Now, safety is big, and I know I've made mention of this already, but it's really important. One of our biggest goals when we're working with individuals is to help prevent falls and other accidents from occurring. And for this reason, we're really dedicated at Family First to providing fall prevention education throughout the Spokane community. And I'm not going to get into a lot of that today, but I do have a few slides to go over some fall prevention tips, because really, ultimately, if we can keep people on their feet, they're a lot more likely to be able to maintain in their own homes. So what just happens when someone has a fall or an accident? Well, unfortunately, oftentimes it signals the beginning of the end of a senior's independence. Not only that, but there may be injuries. There may be changes to mobility, hospitalizations, the need for follow-up skilled nursing care. And then there's the resulting mental impact, which, is fear, depression that sometimes is brought on by not getting to do the things you enjoy any longer. So I always like to give you a few statistics. Did you know that if you are over the age of 75, you're at much greater likelihood of falling? That's pretty straightforward. The next one I'm going to ask you. What percentage of accidental deaths in people of the same age group do you think result in a fall? Any guesses? 40% I hear. 70? He's absolutely right, thank you. 70% of accidental deaths in people over the age of 75 result from a fall. That number is very large. The next one is 40% of all nursing home admissions can be attributed to repeated falls in the home. And so, if you're like the average group of people I speak to, you're not really eager to make a move to a nursing home. And so, staying on your feet is really key. Couple more here. 1 out of 3 seniors who lives independently will experience a major fall each year. And those who suffer a hip fracture, 25% of them, or 1 in 4, will die within 1 year of that injury. So, not really good statistics. The other thing is 2 out of 3 of those individuals will never regain their previous mobility. And then I mentioned this before, but the loss of confidence, the change in mobility, often causes people to isolate. And sometimes there's the thought process that, I'm going to just sit really still. I'm not going to do a lot of moving. I'm going to just get from, my chair to my bed to the bathroom, and I'm not going to do any of the things I used to do because that puts me at too much risk. And, unfortunately, just the opposite is true. Because when you're not using your muscles, they become weaker, flabbier, if you will. And if you're not, your ligaments grow tighter. And so you're actually putting yourself at even a greater risk for falls. So there's a lot of factors that can lead to a fall. And I want to ask you if you have any ideas. First, I want to just talk about the external factors. These are things in our environment, things in our homes, that type of thing. Does anybody want to throw out an idea of what an external factor might be? Yes? That's okay. If you think of it. Yes?
Scatter rugs.
Scatter rugs, wonderful. That's one of my favorites to talk about because as many people know as those are hazardous, I see them in almost every home I go into. Any other ideas?
Stairs.
Stairs, wonderful. Any stair can pose a risk, especially if it doesn't have handrails. Yes?
Inadequate lighting.
Yes, absolutely. Poor lighting, he said. Or if you have the challenge of adjusting to variations in light. Any other thoughts? Yes?
Animals.
Animals. Yes, I don't have that on my list, but you're absolutely right. If your dog or cat gets caught up underneath your feet, you can trip over them.
Chairs with wheels.
Absolutely. Chairs with wheels, chairs that swivel, lawn chairs, things that collapse easily. Definitely. Any others?
How do you balance the need for exercise and the fact that you do exercise, you get benefit from it, but also you're getting a detriment because of probably fall?
The risk of falling during the exercise. Yeah, and a lot of times, that's dealing with your physician and perhaps therapist to set up a really safe exercise plan for you. Because there's definitely a number of exercises that you can do and do safely. Might not be the ones, we did when we were 20, but they're going to be ones that are safe for you to do. All right, well, you guys hit most of them. I'm going to put a few more up here. Improper clothing and footwear. Wearing high-heeled shoes or thick-soled shoes or clothing that drags on the floor. Poor lighting was mentioned. Unstable chairs was mentioned. Steep stairs, loose carpets and throw rugs. And then another one is a lack of bathroom safety equipment. So this would be like the grab bars you have around your shower, commode, bath benches or shower benches. Okay, those are all external factors. Now the next one we're going to talk about are internal factors. A lot of times these are diagnoses or illnesses you deal with. You don't always have a lot of control over these things. And I'm going to ask for your participation again. Any ideas?
Medications.
Medications. That's the first one. If you're on 4 or more medications, you're at much greater risk because those medications can have interactions, side effects that cause, dizziness, drowsiness, fatigue, things that could lead to a fall. Any other ideas? High blood pressure, okay. Or low blood pressure, yes. Sometimes when you move from a sitting position to standing and you have one of those head rushes, that's, related to your blood pressure dropping. So that can make you dizzy and throw you off balance. Any other ideas? I'll put them up here. Okay, weakness or tightness in your muscles and ligaments. Low blood pressure was mentioned. Vision changes, any vision disturbance. Macular degeneration, of course, is a big one. Peripheral neuropathy. Has anyone here heard of peripheral neuropathy? A few of you? All right. Well, for those of you who haven't, it's a degenerative nerve disorder that causes a lack of sensation or feeling in your hands and sometimes your feet. And so as you can imagine, if you can't feel objects that are underneath your feet, you're going to be at more risk for tripping over them. It can also lead to posture changes and, changing your balance. And then neurological diseases. Of course, Parkinson's, Alzheimer's, dementia, strokes and seizures. All of those things put you at higher risk for having a fall. And then if you're someone who suffers from arthritis or osteoarthritis of the knees or hips, and then a biggie, osteoporosis, which is really a talk all in itself. But what you need to know is if you're someone who suffers from osteoporosis, when you fall, you're at just a much greater risk for having a fracture or a broken bone from that fall. So hopefully, as I was talking through those different factors, you were doing a little mental checklist, if you will, which ones applied to you. So as you can imagine, as you add those up, the more risk factors you have, the higher likelihood of falling you have. Now, the second handout I gave you today is a handout that the reason I'm referring it to it now is because it's got a wonderful self-fall risk assessment on one side of that. So hopefully you've talked about in the beginning of the presentation today. There's geriatric care managers. If you haven't heard of them, they have a specialized knowledge and expertise in senior services. They're able to do an in-depth assessment and oftentimes develop a care plan and arrange for services. And then they do a follow-up or ongoing monitoring to see how those things are going. And that can be a great help for family members, especially when loved ones live out of town and they can't really be there to help for that individual. They might want to consider a geriatric care manager. And then of course there's home modification contractors, and those are individuals that are licensed and specialized in making modifications to your home. So you may need to lower counter heights. You may need to make some adjustments to make things more safer. So they're a wonderful resource. And while you're planning for tomorrow, don't forget to, review the role of friends and family members. You want to acknowledge the wonderful job they're doing, but in turn, acknowledge their need for support. Unfortunately, so many times we see that the caregiver, the family caregiver, who's caring for their loved one, oftentimes puts so much love and attention into that they begin to neglect some of their own needs, and that can become detrimental to their health and well-being. And so there's wonderful things out there, such as support groups, and the Parkinsons Resource Center is a wonderful solution. And there's a lot of other support groups that can, address family members or the person dealing with the illness themselves. And then there's Respite Services. Has anyone here heard of the Respite program? A few people? Okay. It's a wonderful program here in Spokane that actually provides for paid caregiving hours so that you can get assistance in your home. And what that does is it's for family caregivers who provide a significant portion of care each day for their loved one. And to acknowledge that need for that time off, perhaps time to go to a doctor's appointment you've been putting off because you can't leave your loved one alone. Whatever the needs, to go out and do a social activity or something you enjoy and give you respite time. And so it's a really neat program because you can have a caregiver who's qualified to come into the home and care for your loved one so you can have that respite time. Now that program is through Elder Services, and there's definitely some different factors to get qualified for that. But I say it's worth checking into if you're in a situation similar to this. And what they do is they contract with home care agencies like ours to actually go out and provide that service. Okay, and when you're planning for tomorrow, don't forget to anticipate for future needs. You want to consider, because conditions likely will change. What are the needs going to be in the next month? In the next 6 months, the next year. So keep all those things into mind. You want to review your legal paperwork. You want to first look at finances and assets. So one good idea or tip I have for you is sit down and make a list of your accounts. Any properties or assets you have. And then you might want to share that list with a trusted individual. It's much easier to do these things ahead of time than last minute. And then review legal paperwork. This is your advance directives, your durable power of attorney, and power of attorney for health care. So often people make up those documents and then don't, it might have been years and years ago, and you don't review them, and things change. So you want to make sure your wishes are honored. So it's really important to be looking and reviewing those. And then review any insurance policies you have. This would be policies that cover healthcare benefits and perhaps long-term healthcare benefits. There's long-term care insurances, there's Medicaid and Medicare benefits, as well as veterans benefits. And so often when we're going to be beginning care with a client, I find that both they and their family members are often really in the dark about what policies they have and what they cover. So before you need them, sit down and take a look at what those cover so you can get the best benefit out of them. Now the last step in creating a plan is really just putting that plan into action. And I'd remind you that you probably are still going to have roadblocks at this point. Change is difficult for everyone. So don't be discouraged by that. What works really well is including the person who's going to be receiving the care in the decision-making process. Another thing that we find that helps is if the care is refused, oftentimes if you can set that up as a trial period. We're going to try this for a month or 2 months. And if it doesn't work, we'll make a change. So often what we see when we start care that way is a month comes, 2 months comes, the individual really usually is getting such a great benefit and appreciate the services, they're not really eager to cancel them at that point. And then sometimes people are just simply more willing to accept the help if it can be offered as a solution for their loved one or the family caregiver. This is to help me with the housework and to prepare meals because I'm feeling overwhelmed. So those are different tips there. So that's creating a plan. And the last portion we're going to talk about today is how to choose an in-home care provider. I wanted to add that because that's what we specialize in. And so I wanted to give you some tips to consider if and when you need someone to help in your home. So one of the first questions you want to ask yourself is the care needed medical or non-medical in nature? Now, all the different tasks we talked about today are considered non-medical in nature, the assistance with ADLs. Now, these don't have to be ordered by a physician, and unfortunately, they're not covered by Medicare either. Home health care needs are needs like nursing support, therapies, nutrition specialists, and those do have to be ordered by a physician and are sometimes covered by Medicare. Good idea is just to simply ask friends, neighbors, family members about what services they know about. What they know. Have they used someone before? If so, how did they like them? Usually a great, source of information. You want to ask, is the agency licensed and bonded? And is there 24-hour support available? If you have needs that are late at night or after hours, is there going to be someone there to back you up? You want to ask how the provider selects and screens their potential employees. I think that's an incredibly important question for you to ask. So often, because we have certain guidelines and laws we have to go by as a home care agency, we are, for those of you who don't know, licensed by the Department of Health. And so we have, certain things we have to meet. And one of those is background screening. We're required to perform a Washington State Patrol background check on each employee. Now, I don't know about you, but we don't feel that just doing something locally in Washington is good enough. Don't you want to know that caregiver was safe in other states they may have lived? So you want to ask, do they do a national background screening? Another good one in this area is, do they do drug testing? Once again, it's not required, but don't you want to know the person in your home is drug-free? You want to ask what type of training they provide. Just how do their caregivers become caregivers? And once they're out there doing it, how do they increase their knowledge? Is there continuing education set up so that they're continuing to expand in their knowledge base and they'll do the best job they can taking care of you? And then how does the agency follow up and resolve problems? Once again, a Washington guideline is that once a caregiver is into the home and placed, that the supervisor needs to pick up the phone and call and check in about once a year to see how the caregiver's doing. Now, once we've placed a caregiver in the home, we think a lot more follow-up actions required. You might want to ask if they do drop-in unannounced supervisory visits. This is a chance for the agency to check in on the caregivers, see that they're dressed appropriately, doing things according to the plan of care, and overall taking a great care of your loved one. And then, do they do any outside surveying so that they can continue to expand and improve on their services? And then if you do, or if you are selecting a non-medical service, you can ask if they have a nurse working on staff. That's not something that's required, but is very helpful during the assessment process and also in the supervision of the care staff. And will they provide for a complimentary assessment? The nice thing here is all these things I just gave you as tips to consider, this is a great time to talk to that agency about all of these things and ask them all those questions. And it's nice if it's complimentary because then you're not charged for that time. Will they provide a face-to-face meeting of you and your caregiver and your family members? And can care be provided 7 days a week and up to 24 hours a day? When I talked about planning for the future and anticipating needs of the future, so often people start with very little help. They might have someone in the home a couple hours a day, a few times a week. But you want to know that when your needs change, and you may need someone overnight, or 24-hour, or every day of the week, that they're going to be able to meet your needs. So in closing, I want to, number one, thank each of you for being here today. I hope I've given you some simple tips to keep in mind as you're looking at the need for care and planning for the need to care. And I hope, if nothing else, that I've given you, the mindset that it's important to plan ahead so that you'll be prepared when the need arises. And so to close, I want to invite Chris Rich. He's our marketing coordinator. And I guess we're going to open up for questions at this point. So he'll help me answer.
All right, thank you very much for the talk.
Thank you.
Appreciate that. Yes, right as of now, we're going to go out on the airways and ask the people the questions that you people want to know about. You didn't happen to see that list of places that, there it is. Have to know who's out there. Okay, these are going to be the questions. First one is for Anchorage, Alaska. Are you out there, Anchorage?
Yes, we are.
Do you have any questions for us
And
today?
We had one question regarding if she has a tip on buttoning clothing. Using buttons.
A tip on buttoning clothing. Well, I wish I had. I know there's a lot of assisted devices out there. And, there might be something made up for that. I'm not familiar with it. So medical supply stores carry catalogs, thick catalogs, full of devices to help with these kind of tasks. When we're in a home, the caregiver assists with that kind of activity.
I have a tip for that.
You have one, Chris?
I have a tip for that, especially for men who wear dress shirts. There are dress shirts out there with a button-down collar, or as I'm wearing today, it's funny that's mentioned about buttoning. Mine has a button underneath, and it's not easy for me to do that. So what I would recommend for gentlemen who still want to dress up and wear ties, go out within the community, go to church, whatever the case may be, get the collar with the tabs inside so you can replace those, and so the collar will stay firm down on the shirt. Do not buy the ones with the little buttons. They are very difficult to button.
Well, that was a timely hint, wasn't it? Any other questions out of Anchorage?
Yeah, buy clothing without buttons.
Okay, we're going to go to Clarkston, Idaho. Anybody at Clarkston?
Yes, we happen to be in Clarkston, Washington, but that's okay. We have a couple questions here. Does
Picky,
Medicare
picky,
help
picky.
pay for home modifications? And I have another question, and then I have a hint.
Okay, go ahead with your question.
Does Medicare help pay for home modifications, like making your countertops lower or such things as that?
That's a good question. As far as safety equipment, around the restroom, shower benches, that kind of thing, if they're physician ordered, usually Medicare will cover that. As far as other home modifications, I don't believe so.
I don't believe so either. I haven't heard of any anyway. Any other questions
Okay,
from
question
Clarkston?
Yes.
Go ahead.
Where do you find a geriatric care manager or a respite caregiver when you live in a separate town from Spokane?
Okay, good
And then I have a
question.
hint.
All right. Well, as far as geriatric care managers go, there's a website, and I wish I had that resource for you right now, but it's the National Association of Geriatric Care Managers. And I think if you just type that into your search bar, you'll be able, their website pops right up. And you can put in what city you're in and find out if there is a licensed geriatric care manager in your town. So, and,
Thank you.
Mhm.
Now the hint is that one of our group here, her husband has a hard time snapping his pants shut, and she has sewed a piece of Velcro on his pants that he doesn't have to do the button, he just makes the Velcro hook together. Now, and that's all for here.
All right, makes sense.
Very good hints. Velcro would be a nice, easy job if they can get it applied properly. Miles City, Montana.
Sorry, this is Miles City. This is for Jennipher. The forms that you showed on your daily assessment forms, will they be on the internet so we can copy them?
Yes, at the bottom of that form, it shows the resource, I believe, I don't know that, is it caregiver
Okay, we would go
library?
to your resource.
Yes,
Okay.
yes.
Now, my other question I have is, in your Cougar Corner, they talk about cough, cold medicines, which ones you should take if you're Parkinson's. And it's a very good form, but they have Zicam on the market for colds and such. Can somebody follow up on that and let us know if Zicam is a medicine that we can take if you have Parkinson's?
Your best bet to do that would be to call Elder Care Services out in Hilliard and tell them they have a registered pharmacist on duty out there, Steve Setter, and tell him you want to talk to him, and he can give you that information right off the top of his head. He's an excellent resource. Steve Setter, Elder
And who's
Services.
that?
Ritzville, Washington. Rural Hospital.
Yes, we're here and we can hear you.
Do you have
We
any
have a
questions?
question about, yes, can you hear me?
Yes?
Okay, we want to know if you live in a rural, very rural area like Ritzville, who you would contact to access some of these services and if they're available and what the cost of some of these services is.
All right. Well, in Ritzville, I know that there are several Spokane agencies who do provide services in that area. So we are licensed to provide services in that area. And I'm not sure if Elder Care Services here in Spokane, I think they probably could also give you that information if you wanted to do, just a one phone call. And their number is 509-458-7450. And
Could you repeat that?
You bet
Could
it.
you repeat that?
509-458-7450. And I think they would have a provider list for your area most likely. And then cost of services is going to vary depending on how many hours of service you need in your home and what the level of care is. So I would say on the average to have a agency support in-home caregiver, you're looking between $18 an hour, probably up to about the $24 an hour point.
Well, I have a question on that. I've called healthcare several times now, and the price that they charge is out of reach. My wife is in a rest home in Spokane right now, and it costs me $7,500 a month for her in the rest home. Now, I can't be there, it costs me $15,000. And you can't stand that kind of prices.
Yes, we all can feel that pain. It's just the facts of life right now. The prices have gone way up, and the people need more care. They're living longer. They need more care. And $7,500 a month sounds like a lot. It is a lot, but that's what it is now. So you kind of have to live with it.
But you think there are services available on a part-time basis, even in Ritzville, that they could come in for a few hours?
Yeah, I do believe so.
Okay, thank you. Now, any questions from here in Spokane? Most of these services are available here, and she can get you started on lining something up if you want to.
Yes.
I just have a comment. I work with in-home healthcare with physical therapy, and we've had the opportunity to work with staff with Jennipher, with Family First, and I just have to compliment your staff. They are so thorough and follow through with our recommendations as far as the safety concerns, and in particular, this one family, we wanted them to get help, and the doctor wanted them to get help so many months ago, and then finally, they did decide to get help, and the change in the patient and their caregiver, their spouse, is amazing. If anyone's on the fence about whether or not they need care, or if their loved one is getting overburdened, to have a complimentary, assessment and have it be by a nurse, I don't know if there's any other agencies out there that do that, and these guys are phenomenal, so I just have to compliment you guys.
Thank you, I really appreciate that.
Go ahead.
Question. Is respite care covered by insurance typically, or usually they said just out of pocket?
The Respite Services program I talked about is not through insurance, it's through, I think it's run through Spokane Mental Health. And basically they come out, you call the number I gave earlier for Elder Services, and they would set up an assessment if they look like you would be a candidate. They'll come out to your home and go through a series of questions that would help them determine if you could get access to those services. Depends on their budget, of course, and all of that. But I can tell you, in order to qualify, the individual has to have a caregiver, a family member, who's responsible for them. I want to say it's 18 or more hours a day to even, get qualified. So it's a significant amount of care you're providing each day for your loved one. And I don't believe that's solely income-based, which is really nice. So it's worth giving the call, even just to do the pre-qualifying call, if you will.
Thank you.
Yeah.
The people back in Washington D.C. and elsewhere are telling us how they want to run the program. All they need to do is come out in the public, or a meeting like this, and sit around and listen to people talk, and they'll find out what the real problem is.
Yes.
We don't care who's flying so-and-so to the Caribbean to go fishing, and they're going to spend 3 weeks straightening that out. We want some people that are sick right now in Spokane, Washington to feel better. And they can do that by just staying home and working.
Hello, Ed and Jennipher. This is Angel at Kennewick General.
Yes,
Hi, there were some participants that attended that wanted to get a copy of the handouts that were being referred to in the meeting. Is that possible?
Definitely. I had given them ahead of time to be emailed out. So if you didn't get a copy, we can definitely get one to you of both of those handouts.
And you can also call
Great,
our
I
office here in town. Here's the phone number right up here, 473-2490, and they can put one in the mail to you for sure. You'll be talking to the office manager there. Any other questions? Okay, Betty?
Yeah, I have a suggestion. At Christmas time, Bob got some shirts, button-down shirts. They look just great, except on the back, they came from Land's End. On the back is Velcro. And you just, do that. And they look just like your shirts.
Great. Land's End
Land's End.
Velcro shirts. That would solve a lot of problems. Any other questions? Congratulate you people. It's 3:01. We hit it almost on the money. So. Oh, there's Walt.
Just a comment and some information. Jennipher talked a lot about falling, and an important factor or factors in preventing falls would be improving our balance and mobility. And here in Spokane, we're fortunate in having a program designed specifically for folks with Parkinson's that is designed to improve balance and mobility. And it's a national program of exercise and dance movements, and this is every 2 weeks at Gonzaga University, and there's no charge for that. And it's at 11 a.m. in the dance studio at Gonzaga. If you need further information, just call the PRC. Thank you.
Good, thank you all. Another thing is they have our Tremble Clef singing group. If you can get up there, boy, the people's voices are so much better and so much louder. You just can't believe what good luck we're having. It's measurable by just when you go in the room, it's just lots of stuff going on up there. So. Anything else out there?
Yes, please. Jennipher also mentioned support groups. And we have a Parkinson's support group that meets on the second Wednesday of every month. It meets from 11:30 to 2:30. This month it is on March 10th, and it is at the Education Center at Deaconess. The Parkinson's Resource Center, that's 910 West 5th, Suite 256. And I'm going to just kind of pass these around. Can I give these to you and just pass them around? I hope some of you will be interested. Thank you. Did I say 11? How about 1:30 to 2:30? We don't have that much to talk about that.
Okay,
No lunch.
Anybody else? Okay, it looks like we got it all out on the, oh, there's one right there.
What was the number of the dance class? Who do the contact for that?
Contact the PRC, the number's right up there.
473.
And she'll give you the information.
Okay, folks, thank you very much for coming. Again, remember those people that are sponsoring us. And I forgot the most important one of all, the Parkinson's Resource Center of Spokane. I'm Ed Ewell. I've been your narrator today, and I hope you had a good time. And things are getting better. Everything you read is they're finding new things about Parkinson's every day. And everybody knows Parky. He's our mascot. He goes to special people that are working hard for our projects and getting us off the ground. Thank you very much.